Morning. Welcome to another biweekly episode of Fixing Healthcare from the Trenches. I'm Dr. Alejandro Badia, and I'm very pleased to have as a guest today a young physician who is actually doing a fellowship with me. Many people know I do have an international fellowship observership, which is very important for me because it allows me to stay in academia, but I find I often learn as much from them as they do from me. And today we'll see that because Dr. Gustavo Becerra Perdomo is from Bogota, Colombia, and he's been with me for the past 6 weeks, and we'll be able to share some of his observations on our troubled U.S. healthcare system and compare it to what's happening in his native country of Colombia. He grew up in Bogota. He is a resident, currently a fourth-year resident at the military hospital Nuevo Granada in Bogota. He went to medical school also at the military University Nueva Granada, and also did some middle school in West Virginia. So I don't know, you've learned English in both West Virginia and Miami. So I don't think either of those places are great for English. But we welcome you, and thanks for joining us today, Gustavo.
Thank you so much, sir, for the introduction. I'm really happy to be able to help with you in this podcast and in your daily profession.
Thank you. Well, you also just finished reading, and I know that you submitted, I think, a book review. You finished reading the book Healthcare from the Trenches, which a lot of these discussions are based on the themes in that book. And I'd like for you first to briefly tell us about the healthcare system in Colombia. I know a bit about the La Ley 100, right? The La Ley 100, which is kind of a basic principle there. But share in just a couple minutes what the basic healthcare system is like in Colombia.
Well, yes, sir. La Ley 100 came out in 1993 and says that a company, almost like an insurance company, has his own buildings, and all Colombians should be have insurance with them, and they decide where they should be going. Also, there is a private practice that you can use like in any other country and pay for your own health care. And the insurance side is really similar here. And what you tell in your book, you get sick, you should call or know where places they take your insurance, and then you should go there. So the basic principles are really similar from USA.
I see. And so what have you seen? Because you know, we see patients on Monday generally. That's our big day, and we'll be there tomorrow as well. But on Mondays, I mean, it's very frustrating for me. So I'm going to adjust my lighting for a moment, but go ahead and share with our listeners, what have you seen, for example, even in workers' compensation, right? As hand surgeons, we see a lot of people who get injured, and a lot of those injuries are on the job because most of us work with our hands. So share some of the things that you've seen and some of the issues that you've seen that, in this country, I think you were surprised about how overly complicated our system is. Give us some insights.
Yeah, it has many steps. Usually, the ideal of healthcare delivery will be if you get hurt, you get a condition, you get any pathology, you should go right away to the guy who knows how to treat you. But actually, I have found there is so many steps, so many ways, and they are all trying to take a piece from your insurance. But the only one who's really affecting and is not getting any good out of this is the patient. So we are here to our job. We do the best we can. We practice. We go to medical school, to residency programs, to our fellowships, and get really prepared to give the best from us. But you find every day this wall between your patient and your work, your profession, and that wall belongs to business. And that is really frustrating for all of us and actually happen everywhere. In Colombia, usually people can get eventually to the specialist, but if you wanna take the first appointment with a specialist, that is not happening before 3 to 4 months. You are not
Wow.
getting there any faster.
Right. And the irony there, right, is that the perception, I believe, is that they think they're saving money, right? These business people, if they have the person seen by the general physician, that somehow that's cheaper. When you've seen in my office, people come in, with MRIs, for example, for something like Decoraveins tendonitis, right? So for the
Yes.
public, this is a type of tendonitis, very common. And people come in with these expensive imaging studies, even though we have the MRI right in my office, right? And
Yes.
affiliated with ortho now as well. But yet we don't use that imaging because we realize we don't need it. So the irony is that the specialist, depending on the problem, oftentimes is actually more cost effective. And every one of those steps that you mentioned, Gustavo, that patients have to go through, because the business people, the bureaucracy is really costing us a lot of money. And the question is, how can we get people to listen, to understand this? Because I don't know what the percent in Colombia is of healthcare expenditure, but in the U.S. it's almost 20%, which is outrageous. It's
Really
twice
high.
as expensive. Yeah, it's extremely high. So you've witnessed that. So the question will be, what can we do to get the public really interested in seeing change? Because what's happening is not sustainable. I'm going to ask you, based on what you observed, your three, what you would think would be three common sense initiatives that the U.S. and maybe even your country, but in very general terms, what do you think that we can do to make healthcare better and more cost effective?
Yes, sir. The first thing I think we should work on is education. Education for the patients. If you take little kids, teenagers, and maybe young adults, you will get a community, really a healthy community that will eventually have less chronic condition, less hypertension, less diabetes.
Right.
And those chronic conditions, if you save them and don't cure them, it will save a lot of money for the healthcare insurance and healthcare system overall. That will be the first one. The second one should be something that is really, really with the goal of ortho now. That is the right education for the right physician. If you get rotator cuff syndrome, and in a general physician office, he will probably take an X-ray, see him the next month and ask for a CT, take him for the next month and ask for an MRI, and the time will go on and go on and go on. It will be a long way before it gets to orthopedic surgeon. So the second one will be give the right education for the right physician for the right patient. So that will be the number two. And the number three, I think I have never talked about this with you, but my dad actually went to business school and has a master on hospital administration. So this is a topic we actually talk a lot with my dad. And I think business guys and physician guys should get together and work together. You have physician team. We are thinking we're the best because we are saving the life. We have the business thinking they're the best because they're making the money. But the problem is between us is the patient. And that's actually the reason why we are physicians, the patient. So if we get to work with the business guys and they get to work with us, we can understand each other. And the biggest or the best thing out of this will be the healthcare for the patient. So my third initiative will be get a better connection between the business guys and the physician.
Oh, the business people, right? We that has a lot of categories. I'm happy to say that we brought on, for example, at Ortho Now, we brought in somebody like that, right, who understands the business of medicine, has done operations, right, because the operations aspect, the logistics is very important in healthcare, and he's run 3 different healthcare systems. So I'm happy to to announce that Doug Landolfi has joined the Ortho Now team. And already I see the difference. Why? Because there is communication, right, between us as the physicians and him and his expertise. The health insurance industry, which is also, that's business as well, right? I've noticed there isn't any communication. We met, and I don't want to call them out yet, but we did meet with two very interested guys from a very big health insurance company, but yet that was over a month ago, and there's been no follow-up. And this is exactly what happens. Nothing seems to change. I state in the book, on the longest chapter is chapter 9 on health insurance, right? That's the big chapter. And I clearly state that there is almost a purposeful veil between the health insurance industry and the people who actually provide the care. And I don't understand why that is. So, because in the end, if we can actually save money, it's actually good for the health insurance industry, right? I've said this. I've tried to discuss this with Blue Cross Blue Shield, which is one of the biggest payers here. There seems to be no interest. I published an article on the MLR, the medical loss ratio. The MLR, medical loss ratio, is one of the several very difficult issues in the ASA, known as Obamacare, where it says that the health insurance company has to spend 85% of its earnings on delivering care. And you say, wow, that sounds like a great rule. Well, perversely, it's not, because if you present to them something that is very cost effective, they're not really interested, because if they save too much money on delivering health care, then they fall out of compliance with this law. So that's a law that needs to be repealed. But question is, how do we get the legislators? I've gone to Capitol Hill. I've met with both senators from Florida. One, Rick Scott was a CEO of one of the biggest healthcare systems in the country, and yet there is even there's very little dialogue. So I think, Gustavo, you hit it on the head, and I'm going to go into my 3. So first one I'm going to hit on is public education. I agree. You brought up an interesting point. Education about how to stay healthy, and that will lower costs, because chronic disease is really what drives up the majority of the healthcare costs, right? So, but also public education to explain to them why healthcare is so complicated and cumbersome and expensive. And if the public knows, just like we did with issues, say, with climate change or even racial disparity in this country, there's a lot of attention because the public has demanded it, and that's good. So we need to get the public interested. Number 2 is in line with what you said: right clinician at the right time. If you get the right physician, maybe nurse practitioner, physician assistant, doesn't matter, an expert clinician, seeing that patient at the right time saves money, and it's good for healthcare. And the last one, which you didn't touch on directly, but I think you've seen this problem being with me, is we need oversight, not authorization. The term authorization is extremely problematic, because you have somebody sitting at a desk somewhere who doesn't know the clinical situation, doesn't understand the medicine behind it, and yet my staff and us as physicians are beholden to these people to give a little number. Nothing happens without that little, whatever reason, it's 9 or 10 digits. I never understood that either, but this long number so that things can happen. We need to really almost eliminate that. And guess what? It's finally happening. I've heard there's been discussions with United Healthcare, certain divisions, minimizing or even eliminating authorizations, because it doesn't make sense. Once the right clinician is then approved or authorized to see the patient, let that person do what they know, what their education taught them to do, and don't introduce all these other factors which delay care and increase cost. So, but we do need oversight, right, Gustavo, whether it be in Colombia or the United States or in Switzerland, where I just came from, the Dominican Republic. There are people who may over-order tests, maybe do things inappropriately, right? I talk about in my book about Dr. Death, the neurosurgeon who's in jail for life. we need oversight. There needs to be oversight, and that's what our medical boards are for. And I think we could set up a more national system to oversee and make sure that we look at the outliers, right? I compare it to TSA. We don't need to fully screen everybody, right? Because that just takes too much money and time, and that's what our healthcare system is built on. So I think your 3 points were very much in line with mine. What overall feedback would you have now that you've spent a few months in the U.S. in our healthcare system? What is your general impression?
My general impression is, first, I'm amazed of how many tools and resources you have here to give
Yes.
the best health care you can, but there is so many administration limitation on your daily routine. That is something unbelievable. You have all the tools to be the best for your patients, and some guy behind your desk, as you say, is not letting you do your job.
Wow. That's a very astute observation, and thank you for introducing the positive, because my not only the book but my efforts with this podcast, it's every 2 weeks. It's brief, right? We should be ending up well below 20 minutes because people are busy. I recognize that, but we need to bring awareness. But at the same time, thank you for bringing up that we do have incredible resources in the U.S. I mean, it's a very wealthy country. And there's really no reason for these problems to occur. And in fact, there is so much money and resources here that if we made healthcare more efficient, we definitely would have money left over to take care for the less fortunate in every society. All right, whether it be in Colombia, where that poor sector is certainly much higher than in the U.S. and other, say, Western European countries. But we have this too. I mean, where I live, right down the street, there are very, very, very poor people, very humble people, and they need help. And there is enough money in the system that if we provide healthcare efficiently, there's more than enough money left over to take care of them. So we simply need to get our legislators, our politicians together, our healthcare megapolis, but it has to come from public pressure. And what I'm asking, as anybody who's listening to this, please don't like this, but just forward our discussions to your friends or colleagues or coworkers from all different walks of life, and let them understand that we can fix this problem. So thank you, Dr. Becerra, for joining us. And in 2 weeks, we'll have another episode of Fixing Healthcare from the Trenches. Please share this, and let's get some dialogue. Thank you all.